For thousands of Australians, a cancer diagnosis means regular, often daunting trips to an overworked, busy hospital. But for a growing number of patients, that's no longer the case.
How are you today?
Yeah.
Are you?
Yeah, just a bit tired.
Yeah, okay.
Chemo at home is a simple concept that's extremely difficult to do well. Administering the same chemotherapy and immunotherapies that patients receive in a hospital setting, but given in the comfort of the patient's own home or workplace. Oncology pharmacist Julie Adams and registered nurse Lorna Cook were both experienced health practitioners in cancer services. They started Chemo at Home in Perth in 2012 to try and give the best possible treatment experience to patients undertaking cancer treatment, all while integrating into existing hospital services.
Everybody knows the story of somebody with cancer and how they sit around for hours in a cold waiting room in uncomfortable chairs, and sometimes they don't get to see the same doctor. The doctor has to refer to their notes to find out who they are and what their illness is, and it's heartbreaking.
Chemo at Home delivered its first treatments in 2014 and since then has grown significantly. The award-winning business is now a national company with over 100 staff offering 24-hour on-call nursing support.
We did approximately 500 treatments in that first year, and we've evolved now to our 100 plus staff around Australia doing about 2,000 treatments a month.
Claudia Van Dyke is a former patient. Her cancer diagnosis couldn't have come at a worse time.
When my son was born, at about 5.5 weeks, I got told I had breast cancer of the right breast, and I was fortunate enough to be put in touch with a oncologist and a breast surgeon who were both mums themselves, and they highly recommended that I do chemotherapy at home. It's really quite an easy service to go through, I guess, and they, the nurses are fabulous. I can't say enough about them.
And for the nurses themselves, the ability to deliver more personalised care is a gift.
We have a certain set of skills that we get to use with patients one-on-one, and we have knowledge that we can give to them. This is a very personal relationship, and it's a privilege to go into someone's home and to be able to treat them at their most vulnerable time.
The benefits of outsourcing infusion therapies go both ways, relieving pressure on hospitals that have been so stretched during the COVID pandemic. And for immuno-compromised patients, not only reduces their risk of exposure to infection, it could just take a lot of the stress out of a trip to a busy hospital. And as the health system continues to deal with the challenges stemming from the pandemic, the demand for home-based care is expected to continue to accelerate, including cancer treatments.
We're always looking for partnerships. We do partnerships with hospitals, pharmaceutical companies, private groups, charitable groups, not-for-profits. So we're looking for more hospitals to engage with us, for more partnerships, because Julie and I truly believe our purpose is to make chemotherapy at home available to anybody who wants it.
To say chemo at home has been transformative for the lives of my patients is an understatement. There are people who I treat now, who get twice weekly intravenous treatments, 3 weeks out of 4 indefinitely. And I think they will do anything they can to never return to in-centre treatment administration.
Despite its name, Chemo at Home isn't just for those being treated for cancer. They also offer infusion therapies for a range of other chronic illnesses as well, like multiple sclerosis, rheumatoid arthritis and Crohn's disease, allowing patients to spend more time where they'd much rather be.
It was such a fabulous experience to have my baby with me and my partner with me at home, and my other family supporting me through that, because it was a really tough time.